Till time of what?
You are now unmuted.
Okay. Hmm? How many minutes you want? I can talk. No, I have no issues. I have added slides to my this. If you need it, I will give you presentation. Otherwise, I can wind up in any minutes. You tell me to start because already 5 minutes late. You only tell me. Uh,
You
Good
are
morning,
now muted.
everyone. For today's program, we have a well-known speaker, Dr. Shama Kedar Madam, Associate Professor and Unit Head of Obstetrics and Gynecology Department at Indira Gandhi Government Medical College, Nagpur, Maharashtra. She is the in charge of HIV and STI unit. She is the Vice President of Menopause Society of Nagpur, Associate Member of Royal College of Obstetricians and Gynecologists, and a postgraduate teacher for past 20 years. Ma'am has numerous achievements and awards into her credit. She has developed unique workshop of pelvic anatomy revisited evidence-based cesarean section. She is the author, editor, and co-editor of numerous books. She has presented various papers in national and international conferences and has numerous publications in national and international index journals into her credit. She has won MS Signature International Award for Phenomenal Leadership in Advocacy and Branding of PPH. She has won first prize for paper presentation and gold medal at 31st AICC RCOG 2017 and also in National Conference of AIMW in 2011. She has also won Dr. Khandwala Best Paper Award in the year 2016. She is the recipient of Gold Medal of NOGS in 2016. So now I request Dr. Shama Kedar Madam to continue with the presentation. Thank you.
Thank you for the nice introduction, Doctor. At the outset, I would like to thank Dr. Khan and Mental College professors for inviting me for such a dear topic of which I really want to talk on this topic because I'm working in this topic since a long, since 2000, when the inception of this PPTCT program came in. Since that day, I'm working for this HIV people as well as HIV on for the HIV detection, then treatment, and then people live with HIV and awareness program. So thank you once again, Dental College, for inviting me. No, why we need to talk on HIV after 10 years? Because still our habits, our awareness is still somewhere we are still lacking. Because if we why we are lacking, because of suddenly whatever fear we used to have of HIV 20 years back, it's no more. 10, 15 years, 10 years back, it was there, but since 10 years, I'm not seeing anything regarding awareness about HIV. The reason behind that, like, just say, if I tell you, like Corona now. Corona is what has happened. Corona is पहले जो first wave had come. That time we were all so concerned, so concerned. We used to wear warm masks, we used to wear gloves, we used to see to we never went outside. We were always very careful for not contracting that disease. But as now, post 8 months of Corona, again are without mask. We are least bothered. We are roaming here and there because I see on the roads people without masks, without our police and all that complete government's officials are after that, that everyone should be wearing mask. But no, there we are lacking because somewhere in our mind we have decided, no, no, it's over. No, again the second wave is coming. So this way, like HIV also, but yes, because of the awareness also, I may say that because of the awareness of HIV, the count of HIV has come down too. So this is very, very good for us because this way we should be able to control our HIV cases in, and especially I would like to tell you the because I am an obstetrician and gynecologist. So what happened? This HIV patient used to come to me, and we used to deliver this patient. We used to detect them. We used to counsel them. We used to treat them, and then we used to deliver them. And post delivery also we used to hand over to the HIV committee. So in this way, but I am saying the HIV patients is reduced a lot. Somewhere we have also taken the precaution of awareness and as well as taking care for this HIVs. That's why also the another thing is it is decreasing. That is very beneficial for us. So why we want to because why it has happened? If we percolate this knowledge to our youngsters, our teenagers, our what you call those who are going to be a future parents, those who are going to be future, those who are in a reproductive age group, or those who are in adolescent or teenage group, if we try to give them inculcate this knowledge of HIV awareness or STI awareness in this then only we will bring down to zero to HIV. Still, there are patients who are long as it's a lifelong treatment, you need to take it. So, up to us how we can try to take this HIV and STI and how we should be making a youngster awareness of this HIV and STI and make them see to that they are never be they should not contrasting they should percolate this awareness measures to all the public. Sorry, I am having a little bit of okay. So the next slide. When you say why we need to take this HIV and this thing awareness of HIV. Okay. Let me tell you a very small story. Story. Why? I would just want. Why you say why you directly tell the knowledge of HIV? And just to share a small story of this. The story is that whenever yeah, whenever there was a in a village, they had given all the young a task. a task of taking this cross to up to what length they can take this cross. So everyone was given this task, all the teenagers and adolescent age group. So when this task was given, they were all started their journey together. They were having good moral teenagers in that, a bad moral, and a youngly smart, overconfident people were also in this group. Then what happened? They were dragging. It was of a wooden thing, and it was very, what you call, very heavy cross to carry all over. So everyone was trying to go with that cross, running, trying to finish the finish line. They had set up one finish line to that. So once this cross was in, one fellow was there. He was a little bit overconfident, little bit very smart person. He thought, ki, why am I dragging this such a big heavy cross to that side? It's so stupid to carry so much of a burden on my shoulder. So he said, why not? Let me do a smart one. Let me do a little bit of this thing, a smart activity, and he tried to cut short the small part of that cross. So when he cut short that small part of the cross, he was so happy that it's going so easily. Now it is little bit less heavy, and now I'm able to carry that. Once this, he again said, "Arey yaar, it is so this thing. Let me cut a little bit too." So he, so that I can cut down a little more, and I'm able to carry it better way. So he cut it down again. In this way, he started cutting this cross, and he was so proud of himself that, see how great I am. I am taking this cross with such a, no, that much of this thing was not there. But what happened when they came to one bridge? There it was, suddenly they realized, and he started going in front, and he reached to that bridge first because it was a light thing. So he reached there, and once he reached there, he saw, how can I cross that bridge? This is a bridge, and now I have to cut this, climb this bridge. How can I do that? So he tried to. Uh, then he saw others. When he saw other people, they saw that they were just in that cross, and they were trying to go over that bridge, and they bridged it, and now they are able to go that side towards the finishing. So he saw, then he realized his mistake. If I have not cut this thing, I cannot, I would have easily lost that bridge. So, and it's too short now. Now I cannot do anything. So that's the reason he was very ashamed of his act, because he was cut shorting the path. In this way, if you try to cut short, moral of the story is never try to use shortcut in, or it will cut your life short. The moral of the story is this. The reason behind this story is because nowadays our youngsters try to cut short their thing, and that is very dangerous, because adolescence is a vital stage. Nearly 1.2 billion are adolescent in worldwide, and 21% of them is young population. Hormonal changes lead to onset of puberty, sudden and rapid physical growth. Since you are all a doctor, you must be knowing, since the puberty, sudden there is a spurt in the growth, and the the person starts growing physically, mentally, as well as emotionally, psychologically too. This is the way the development starts, and there is the start of the character, and the all emotional and psychological changes, assertion of self identity. Till that time, nobody used to bother to look into the mirror, but suddenly there is a self identity is occurs, sex drive occurs, attraction towards the opposite sex occurs, and they start thinking, they try to look beautiful, smart in a way. So this is the adolescent phase. Everyone goes through this phase in them. But if unaware, may end up in acquiring deadly infection of HIV and STI. If we try to be over smart, try to, because there is a sex drive, there is nowadays we are very very friendly with each others. So if it is, we are very friendly with each others, and then somewhere it's a very thin line between a friend and a very close friend. If we try to, in a opposite sex, I am trying to tell you nowadays, in the olden days when a girl and boy never used to talk distance, but now everyone गले में हाथ डाल के ही घूमते हैं, and all friends are in groups and they are all sharing. This is a routine because we are most of the time following the western. But okay, everything is very nice. You should be friendly with the opposite sex. Very good. But there is always a thin line. You should not be crossing that thin line. That is very, very important. So then to talk on this, why I'm telling this thing? Because if we don't try to do this thing, if we cut short our what you call that line, if we try to cross that line, we may land up with this deadly HIV infection. Nowadays, 36.9 there in worldwide, and of these 2.6 millions were the children, and they were also less than 15 years. 15 years means they must have acquired from the mother. The mother must be having a mother and parents. It is generally come from the parent, not only the mother. So the parent maybe had a bad life or previously, so it may happen that way. So you have to be very very careful in choosing this life. So India is the third largest country in the world. The people living with HIV is 2.8 million. So it's very very high. The Manipur, Andhra, Mizoram, Nagaland and Maharashtra भी हम किसी से कम नहीं है. Manipur is there because it is most of the time HIV is spread through IV use drugs. Where same syringes are using of the same syringes by each and everyone. So when intravenous drug users may land up there, part in India is higher for HIV because of that reason. So, so now this slide, you all know that is just a human immunodeficiency virus. So it decreases the immune system. So that is the immune system. It decreases. So what will happen now? If this is a very small retrovirus of hardly, it's not millimeter, it's nanometer in diameter, 90 to 120, and it remain alive in human discharges, decreases progress of, and the most important thing is decreased. All immunity is decreased. The opportunistic infections come in, like tuberculosis. Any other disease may land up in serious condition. So this way, it starts. This is very dangerous for us. So, other point here is this defense. So whenever HIV attacks the lymphocytes or blood cells, that starts decreasing your CD4 count and decreases your resistance and invites the opportunistic infection. This is the way. This is the defense to crumbles your this. Now, just to summarize, that route of transition may be sexual, homosexual, or a hetero. Blood may be IV drug user, needle stick injuries, or blood transfusions. Exposure to open wounds or mucous membrane, organ transplant. But and perinatal is mother to child. But the most important now, yes, blood transfusion is out of this thing. The reason behind that, we try to test the bloods, and then only if it is HIV negative, then only the blood transfusion is given to. Previously, हम आपने अमर अकबर एंथनी में आऊंगा तीनों अपने माँ को लगा रहे थे, isn't it? It's like that, but अभी नहीं. अभी it has to be tested. कोई भी आप माँ हो, बेटा हो, कोई भी हो, you have to test your blood for HIV. Then only the blood transfusion is given. You all are doctors, all know this. So signs symptoms immediate within 3 to 6 months. They आज हमने acquire किया तो immediately we will be able to show the symptoms of that. So it is immediate within 3 to 6 months. There may be sore throat, rash over body, or immediately come to the AIDS also. The most of the time, why I'm telling you, the most of the time I come across these pregnant ladies, and then they were well and hearty and good, physically very good, healthy as they not even say thaka hua hara person, but when they tested them positive, so then they realized they have already had this infection, right? So sometimes whenever the opportunity infection lands in, and that time they acquire the AIDS, that's acquired immunodeficiency syndrome, because there is a collection of 4 5 symptoms, and then they become a serious thing. So first you have to detect this by blood examination. Most common is ELISA. If positive, infection is negative, then repeat after 6 months, because this is a window period. In this window period, you may acquire, uh, you may be negative, but later on you come out positive. So this way you will be able to notice. So weight loss for more than 10% of your weight loss is there, then it may be a HIV. The key fever, diarrhea, it is there for more than a 1 month. No, you should not be sitting at home. You should be getting yourself tested. So this signs and symptoms of HIV. Now, how one prevents this? Safe. The most important is safe, good moral conduct, use of condoms, test free blood transfusion, no injectable drug, and use of disposable Yes, nowadays, even in all colleges, nobody's. Previously, in our residency, they used to have a glass syringes, needles, and we used to sterilize it and we used to use it. But now it is not like that. So you HIV tested HIV, this thing, HIV free blood transfusion, no injectable drug, use of disposable needle and syringes, preventing mother to child transmission. So mother is healthy. If mother is HIV, she is 100% chances of acquiring that infection to giving that infection to the child too. And if one should, if the mother is HIV, and if she wants to abort the child, one should go ahead with the unwanted pregnancy, should abort that pregnancy. And the most important, you should start it immediately. Previously, we used to give only at the time of the delivery, we used to give antiretroviral therapy. But now, with the government recent policies, we give the HIV treatment right at the beginning. And right at the beginning, we start this HIV treatment. Right, she became pregnant, and the way it gets detected and she comes positive for this HIV, she is started with this. Okay, so this is the way one should start the treatment. Should not wait a long for that treatment to नहीं आराम से करेंगे. No. This is one should be the second most important is sexual transmitted disease. That we said one of the root of infection, and the sexually transmitted diseases is because these diseases are this is acquired diseases because of the sex. And if these diseases are not taken care, they increases their risk of HIV by 10%, 10 folds. So you have to be very careful that the young should not be indulged in this unsafe sex. as they should not acquire this sexually transmitted disease. So I have included this slide in my presentation just to tell that young people may contract with syphilis, gonorrhea, chancroid, and lymphogranuloma venereum. So we have to be very, very careful because if AIDS risk increases by 10 times if you have a STD in you. So if you try to tell the youngsters, adolescents, be aware of things. Don't take it lightly. Sign symptoms will be ulcers over genitalia, painful ulcer, pus discharge, inflamed genitalia, and large lymph nodes. We always see for the lymph node infection and all this thing. So how to react to this? Contact venereologist immediately. Most of the diseases are curable. Faster the action, more effective is the result. Regular checkup, most important of routine should make that you should spread this awareness to your adults and nothing should be taken lightly. And thoda sa ye discharge hai, no, it should not be taken lightly because side effects of STD is very, very high. If you take a female, she may land up with the infertility. Even male can land up with the infertility. Abortions, stillbirths can occur, congenital abnormality of the baby may occur. If you see to that, if they are having the parents are having syphilis and the mother acquired syphilis, the baby may be having congenital syphilis. So blindness may be there, whatever may be there. So one has to be very, very careful when you see for this side effect of STD. Now, whenever we see this STD, one should be contracting immediately and they should always remember the good moral conduct, safe sex, use condoms. Why government has displayed condoms everywhere? The reason behind that. Excuse me, I am hearing some noises. Excuse me. Yeah.
You are now
Can you
unmuted.
please mute your microphone, please? Yeah. Yeah.
You are
Thank
now
you.
muted.
Thank you so much. So, STD patient regular checkup, HIV infected patient regular checkup, no discrimination with HIV and AIDS patient. That is the one should be very, very careful. You should not be like previously we used to write universal precaution on the HIV patient's card. That was our code. That is, she is a HIV. So we though we thought we are very, very smart enough in writing universal precaution, but no, we are total universal precaution is taken for each and every patient of yours, whether they are symptomatic, whether they are asymptomatic. You have to take this universal precaution in every person. Reason behind that is because you may not know which patient is HIV. So treat each and every patient may be having HIV. You should be taking universal precaution. Never write this because if you write this, you people with HIV and AIDS, that is PLWHA, that group may come you and they may sue you. You are discriminating us. You are trying to tell people by using universal precaution in our card that you are making us separate from others. So be careful never to discriminate between for this HIV patient. So the we have to be very careful. Even most of the hospitals were having code for it. So be sure. One should be not giving code also public. Now, why I'm trying to tell you adolescent, teenage, or young reproductive age group people you are. Why sometimes there is a people peer pressure. See, in हमारे हिंदूस हमारे मीन्स हमारे संस्कृति में इंडियन संस्कृति में the Indian culture we have that saying one should be back at home at 7 o'clock in the night. In Marathi they used to say सातच्या आत घरात किंवा in our Indian culture it is whatever religion may be. The Indian culture says the girl or boy should be at home in the proper time. But what happens nowadays? We are very, very friendly with each other. We have a peer pressure who are of age, same age, same class. They try to influence you to act to get you to do something. And it's a human nature to listen to and learn from others in your age group. It may be a positive. Positive है तो best is best. But negative है तो you may land up with because we are observing. I am observing our youngsters that when now they started drinking at a very early age group. It's a peer pressure. क्या होता है एक पी के देख See, क्या होता है you may indulge in a sex once. No, this is wrong. So positive, helping in exam, how to study, to get early in the morning, how to play sports, reassuring terms for advice, understand a problem faced during difficult situations and understand empathize. That is good for you. But if it is negative, you may land up with inner soup. So one should be very, very careful whenever they say offer they generally like negative is offering cigarettes, alcohol, insisting for indulging in sexual activity, bunking classes, where हमारे पॉकेट मनी नहीं का पूरा पड़ता है तो हम स्टीलिंग एंड चीटिंग करना पड़ते to just justify our things like alcohol, tobacco, and all this thing. So that is very, very dangerous for us. So the youngsters, teenagers should not indulge in this. And tobacco is the most commonly used thing, and this causes addiction and very slow side effects on brain, heart, circulatory system, lung, oral cavity. I need not tell you. You must be seeing the oral cancers too. And so that is the very dangerous part of it. The government has given the advertisement on your cigarette pack, isn't it? But what happens? गर्ल हम लिसन करते हैं वो उसमें इतना बड़ा कैंसर का पार्ट दिखाया है थ्रोट का कैंसर वाला पार्ट दिखा है वी डोंट ट्राई टू स्टिल वी नजरअंदाज कर देते हैं उसको एंड वी ट्राई टू टेक दिस टोबैको just forget that tobacco may do so many things in your life so one has to be very very so there are some do's and don't for adolescent for your age group people. I'm insisting on this because I don't want our future generation to indulge in this. So never because हमने कितने बार देखे अकेले अकेले गए थे कुछ सीधा हो जाता so always try to be together everyone together so it's very less likely to land up in anything and the most important inform your parents of your new friends and of your to whom you are going whom you are visiting you are आजकल pajama parties भी चलने लग गई है I don't understand they try to go to the friends home and stay down yes but the your parents should also know to whose you are going and the parents also should be talking to each other's parents say yes your daughter or your son is at my place so you need not worry I will see to that so and friend कोई भी हमारे friend ऐसे acquire करते हैं तो ये we should be telling our parents कि ये मेरा नया friend है so parents should be knowing all these things that is very very important for us because then only they will know and if you are coming late in or returning late from your classes or whatever it is just see to that call home and then yes I'll be late by 9:30 10 or whatever may be timing but never be late other than that most important part nowadays you people go in together so inform your parents or teacher if someone touches you and it is you feel it is not good whether it is a boy or it is a girl the person have that instinct in their mind if anyone touches you unnecessarily the wrong place at the wrong way immediately you can sense it this is हमारे इसमें वो senses है if you sense it, immediately tell your parents or immediately tell your uh, teacher that this boy or this girl is unnecessary trying to touch me. So respect your parents and teacher. Be friendly with them. That is the most important mantra of this thing, that you should not be getting unnecessary advances from others. That is very important. Keep your negative emotions in control. Like in adolescent age group or in a teenage group, like in your age group, we immediately angry. हमें एंग्री हो जाते हैं, और एंग्री हो जाने के बाद हम धाड़ से बोल देते, whether it is the parents or even if you are teachers. Nowadays I am seeing people without giving respect to the teacher, just try to tell the teacher that this is the way. No, try to control it. हमारी इंडियन संस्कृति बहुत अच्छी है. वी ऑलवेज गुरुदेव भव हम बोलते हैं, गुरुदेव को हम हरदम नमस्कार करते हैं. तो कहते कीप योर एंगर इन कंट्रोल विथ योर पेरेंट्स ऑल्सो. Keep your anger, keep your negative emotions in control. Never hurt anyone, whether with your language or whether by your language too. So that is very important. In your age group, you should be taking. The most important is class. First, you should be calm down, lower your voice, acknowledge other person's request, state your request, and propose a solution to it. It's very simple. सो इट्स वेरी सिंपल दैट यू शुड डू इट. हम बोलते हैं ना कि जब भी गुस्सा आता है पहले 10 बार काउंट करो, उसके बाद देन यू ट्राई टू कंट्रोल इट विथ देन ट्राई टू कंट्रोल. एंड इन दिस वे you should go ahead with your controlling anger. Now uh, try to control. Remember, measure of discipline is a measure of love. So, or if you are a disciplined person, you will get equal love from your parents as well as from your teacher. Then comes your don'ts. Do not give your photographs to anyone, whether it's a boy or girls. Never share your photographs with others. Nowadays, with the social media, we are trying to put you on Instagram or कहाँ कहाँ हम डाल देते हैं. Do not give anything in as form of photographs or even in form of writing too. So never give this thing anyone, because that may be used against you for any bad reason. So do not give anything in writing. Then do not go to the wrong sites on the internet. आजकल हमको इंटरनेट, अभी तो गवर्नमेंट ने इंटरनेट वापरने के लिए बोला है, मगर डोंट गो टू द रॉन्ग साइट्स ऑन द इंटरनेट. I have seen so many people getting आजकल वो PUBG and all these things, they you start playing all these things and you lose your control over your studies and all this. So don't try to indulge in all these things. So you have to be very very careful. Don't hide uncomfortable facts from your parents, however difficult it is for you. Whatever uncomfortable thing है, फिर भी अपने parents के साथ share करिए. Then next important thing is that ever don't take any medicine on your own given by friends. So generally in the parties, don't try to take anything. And the most important, any medicines given by anyone, don't try to take it. Always there is a doctor for your consultation. Try to consult. Don't be with friends with people who pressurizes you, because that sometimes if any of one of your friend is pressurizing you, you have to be very very careful. That try to be avoid that pressure and don't go against family values. Okay, so this is very important, because if you try to do all these things, so that way, yeah, because such habits, if you try to do partying a lot, you may, because your pocket money तो पूरा नहीं पड़ने वाला है, so you start stealing. So please be aware of all this. Tell adolescent age group, don't do or indulge in all these activities. That is very very important for you. So life is a game of rules. Don't break the rules, and otherwise you may land up in a problem. So be careful whatever way you are with your this thing. because this oral lesions, try to, you're a dentist, you all are dental from the dental college, you should see to that tobacco may lead to all this thing, or is the whatever may oral lesions may land up with this HIV or STI and all this thing. Then the nicotine easily, they say nicotine easily, sorry, nicotine easily moves from the bloodstream into the brain and first moves to the lungs where it absorbed in the bloodstream. The heart pumps it throughout the body, including brain. So your brain ka activity becomes less. So you have to be very careful. So don't try to take nicotine. Don't try to indulge in alcohol because आजकल थोड़ा सा ले लिए तो क्या होता है? Young age, I am seeing young teenagers drinking. Be careful, avoid all these things. It may cause all the bad habits and may lead to your liver damage, heart attack, dementia, blindness, neuritis is the most common thing nowadays. Youngsters are indulging all these things. So be aware. So effect of alcohols are very bad. Try to control that. Never try to take that. That's what I wanted to tell you. So say no to alcohol because that is the most important thing we should be doing it. So refuse it, no thanks, give reason, broken leg, whatever, so many reasons are there. Change the subject, strengthen, whatever, or tell them health problem. So you can do this thing, but try to be that once you are bad this thing, never try to indulge anything and never make a statement like I'm not ready, we will decide later. This is a not a very confirmatory statement. So people, you are giving people a little bit yes from your, but just putting off this decision for a time. No, be assertive. No, I'm not interested. That's all. Be careful. That way, you are very sure of choosing the right path because birds of feather flock together. Birds cannot help it if you, as a human, can sprout feathers of your own choice. Choose the kinds of people you want to spend time. It's equally important. So be careful. Otherwise, you may end up with the of HIV. Dr. Niharika, is there a time shall I skip this diagnostic tools in HIV? Dr. Niharika,
You are now unmuted.
it's already, I think I have crossed limit of 45 minutes. Am I? Okay. I, yeah, okay. Wanted to you being
You
a
are now
young
muted.
doctor, I wanted to tell you what are the diagnostic tools in HIV. I'm just trying because you should be knowing with the recent advances what is going on all over the world. So this is the tools I would like to tell you what are they. So one because lab diagnosis is the fundamental for detecting and monitoring this infection. Many diagnostic tools are available based on both detection of HIV antibodies and virus antigen or nucleic acid. We are just going to see what it is in next uh, few slides. There are kinetics of responses. I don't want to go in this because you all know this. Uh, the in use to test HIV, flow cytometry is used for monitoring CD4 cell count because CD4 count is less, then the person is very dangerous for spreading the infection as well as acquiring opportunistic infections. So it is very important. And the nucleic acid is and the PCR based assays are used to detect this virological failure by monitoring this HIV load. And a dried blood spot is also effective to detect early when diagnosis of HIV infection or when cold chain transport of liquid plasma samples of logistic contagion. And the another important is Western blot. So there's some few tests which you should be knowing this. And the most important is out of this is rapid test antibody detection. It is again based on one of our four immunodiagnostic principles: particle agglutination, immunot, dipstick like immunofiltration, chromatography. This is one of test usually uh, highly specific and sensitive. One can use this. And the assured, you should be seeing the ideal point of care test is the assured, affordable, sensitive, specific, user friendly, rapid, and robust, and the most important, equipment free and deliverable to end user. That assured, if it is there, so our criteria is outlined by WHO, primarily aim to provide same day diagnosis. अगर दूसरे दिन हमारा कोई पेशेंट लैब इन्वेस्टिगेशंस लेने के लिए, very rarely, most of the time they are least bothered. So if you give them the same day, then it will facilitate immediate checking and you can start the treatment part. And so we will not lose our patients very much. Then the next is interpretation. The rapid test. This is a non-reactive test results. You have a test also nowadays. That can that has also come for us in recent days. HIV one, HIV A, HIV B. They can say rapid. So this rapid test are there. So we will see one by one which are the rapid tests for us. The rapid test, one of the important another test is ELISA, enzyme linked immunosorbent agent assay that we all are doing in our hospitals for detect HIV. So this is ELISA generation, which generation now it come to the fourth generation. So it detects the IgG enzyme antibodies HIV 1 and HIV 2 plus 1 and 2 both. So this is recent HIV ELISA test you all know, and that you all are using in your hospitals for that. Another one is Western blot. It is an antibody detection test. However, unlike ELISA method, the viral proteins are separate first and immobilized on nitrocellular cellulose strip. But nowadays, HIV-1 Western blot and HIV-1 IFA are no longer recommended. It takes a time, so it is always we land up with the ELISA and this uh, and rapid test. So another important is your NAT test, nucleic acid test. It is a technique introduced in 1990s and is highly sensitive and specific for viral nucleic acids, and it is based on amplification of target regions of viral RNA or DNA. So it is in newborns of HIV infection, whom maternal antibodies are present, one can detect with this NAT test. So this is very very important that you know to be performed. So this is uh, that what has happened. And I think that for the hello, yeah.
You are now unmuted.
Another text is it, that what we generally use uh, when baby is born. We try to hide blood spot from that
You are
baby's
now muted.
stone, and we Hello, can you hear me? No,
You are now unmuted.
I want to give you a quick sample is don't know about internet little bit. This is a quick home HIV that
You are
one
now
can use
muted.
it with this membrane of the near the this. Another is Urasure that with the urine also you can do like a pregnancy test too. Then on-site TB HIV antibody rapid test kit has come up whether you have a TB or whether you have a HIV rapid test has come up. Then the most important is smartphone dongle detect test is also there. You to just put your thumb on this and you can detect whether you are a HIV or having HIV or not. Then this nanotechnology is very important in the western side, not in our country. But we what is this dongle? This is it's a dongle you put your smartphone to it and then it can detect it. So this is the way one can do this dongle drive device also can be used. Then very easy to detect, but once it is very difficult to adhere to this treatment for a lifelong. So what I would like to suggest, if you don't, best thing is don't indulge in any unsafe activity. So it's such a big disease. So this is many little bit disclaimed resent problems also there. So to bother about those things. This is little bit in detail which I didn't want to share with you, but I cannot. I don't- So probably test for HIV monitoring comprises of CD4 T cell count, HIV mutation assays, point care now, cytometry, mini POCs, PIMA test, ALER, and CD4 test there. So portable PCR test for every quantification are currently on the market, but several are in pipeline. So you, as a postgraduate or as a so the risk is not being to get trashed. It is difficult to adapt to that. Once one should be uh, treatment of the life. So you should in your to or with other you don't be up not stand up as a doctor your to tell the problems of the doctor be able to very much important. So Hari, hello, hello
You are
Nihari.
now unmuted.
Oh, so yes, yes. nowadays Maharashtra is standing less. Initially, it was very high in the first, second west was Tamil Nadu, second was Maharashtra. But Maharashtra now I also having since 2005 is study less. This problem, I don't know. Maharashtra is less. I'm sorry. Yes, there is a problem. It is false positive, false most of the time. Uh, if it is a false positive or false negative, even because sometimes the balloon is sometimes high because of this technical error also reading also and the positive and the false positive, false negative. So the most important, you have to again retest after 3 months. Please, it should be next month. You can do it after 6 months or get your reconfirm whether your test. Okay. Anything else? Yes. Why it is relevant? Because it is relevant because this medical student is the future doctors, future public person who is going to cater the society. As a medical student is a lifelong learner, lifelong educator in public face, and if this is aware of his consequences of HIV, and then only he will be able gain
You are now muted.
the knowledge to the society, or he will stop, he will give awareness of the society that this disease in the society. And as a medical graduate,
You are now
right,
unmuted.
day one, like this, you are going to, because you are to be a uh, reaching the society, right? Day this medical graduate, you are called also in this curriculum. It is added in your curriculum. Is it? I don't know. Yours not, but it is added in our medical part of it. Unable to hear you. Unable to hear you. I'm able to hear you. I'm sorry for the internet. Yeah. Can you hear me? Okay. Anything? I don't know how. Yeah. Just send me the certificate, please. Dr. Yeah, sure. On WhatsApp or whatever. Thank you so much. Shall I leave now? I hope I don't understand how much they able to understand what I wanted to tell them. Uh, because the internet, I don't understand how much they have. Okay. Okay. Now I'm logging out. Okay. Thanks a lot for.
You are now muted.